Okay, thank you, Jude. Good morning, good afternoon, good evening, all of you, depending on where you are. Thank you very much for joining this PhD defense of Jimmy Osuret. My name is David Musoke, and I work in the Department of Disease Control and Environmental Health at the School of Public Health. I know we have both an audience here in the room in Kampala, but also a good number of people who are joining the session remotely. So just to give you an overview of how this session will go. So after these few remarks, I'll be inviting the candidate and requesting him to present his work in about 30 minutes or so. And thereafter, there will be a group of examiners, both internal and external, who will engage the candidate. And thereafter, we'll also give a chance to the public to engage the candidate, both within the room, but also those online. And thereafter, we will have another closed door session to deliberate as the examination panel, and thereafter return to the room and have the final verdict and discussion. So with that, I just wish to introduce the team of examiners and the panel that is part of this particular process. But before that, I would wish to introduce the candidate. So the candidate for us today is Jimmy Osuret, who many of you know. Jimmy is a research associate at the School of Public Health in the Department of Disease Control and Environmental Health. He holds a bachelor's degree in environmental health from Makerere, as well as a master's of public health from Oxford Brookes University in the UK. And he's worked with us at the school for over 10 years with research done in environmental occupational health, but also recently in the area of trauma, injuries, and disabilities. So that is our candidate for today, and he's been working with a team of supervisors, both from Makerere and elsewhere, including Associate Professor Lina Tuyambe from the Department of Community Health and Behavioral Sciences, who's here with us in the room. Thank you for coming, Prof. We also have Dr. Victoria Nankabirwa from the Department of EpiBio, who has been working with Jimmy. We also have a supervisor who is online, Prof. Ashley Van Niekerk, who works at the Institute for Social and Health Sciences at the University of South Africa and the Masculine and Health Research Unit as part of the South African Medical Research Council. Thank you so much, Prof. Ashley, for joining us, and we appreciate your support of the candidate. The examiners, we have three. We have Dr. Wilson Mwezi, who is an Associate Professor of Behavioral Sciences and Mental Health in the Department of Psychiatry at the School of Medicine here at Makerere University. Thank you so much, Dr. Mwezi. We also have an external examiner, who is Dr. Megan Prinsloo, who is from the South African Medical Research Council and the University of Cape Town, whose area of specialism is in epidemiology. Thank you so much, Dr. Prinsloo, for being with us. And last but not least, we have the opponent, who is Professor Mary Hasselberg, a professor of public health epidemiology at the University of, at Karolinska University in Sweden, and she works in the Department of Global Health. Her area of expertise is injury epidemiology and prevention, including road traffic injuries and burns. With that, I wish to now invite the candidate, Jimmy Osuret, to come and share his work. And this, as I said, should take about 30 minutes or so. Then we shall head into the next session. Thank you very much.
So thank you very much, and welcome to my defense. So imagine this, it is 6 a.m. in Kampala, and the roads are busy with vehicles rushing to avoid the traffic congestion. But on the sidewalks, there is a different kind of movement. we have young children who are trying to make their way to school. And amidst all that, we have a traffic warden who comes out to help them safely cross. And this is where my journey begins. And I'll present my thesis titled Road Safety Among Primary School Children in Kampala, Uganda, the Effectiveness of a School Traffic Warden Intervention. In my presentation, I will introduce aspects of road safety, the key problem that this study addressed, why the study was important, the conceptual framework that informed the design of the study, the objectives, methodology, discussion, and the key takeaway messages. Pedestrian road traffic injury prevention and control is a global public health priority because of the burden, specifically from the Global Status Report. Approximately 1.19 million road traffic deaths were recorded in 2021, of which pedestrians made up 23% of these fatalities. And road traffic injuries are the leading cause of death in children and young adults ages 5 to 29. The risk of death is 3 times higher in low-income countries than in high-income countries. So reducing road traffic injuries is associated with implementing a safe systems approach that aims for a transport system with 0 death, and also it accommodates and anticipates human error, but also most importantly, promotes a shared responsibility for road safety among all road safety stakeholders, and also holding the road planners and designers accountable for safety in the system. And it's achieved through implementing the pillars of the Decade of Action for Road Safety, which has aspects of a multimodal transport, safe road infrastructure, safe vehicles, safe road use, and post-crash response. If we are to look at the road safety situation in Uganda, specifically the road traffic crash comparison in the year 2019 to 2024, we see that the overall trend is upwards, which indicates that Uganda did not make progress in reducing road traffic crashes. Then for the trends in death, or based on the road user categories for the same year, we see that pedestrians and motorcyclists account for the largest proportion of death on our road. In the statement of the problem from the Kampala capital city crash report, 17 fatalities and 57 severe injuries were registered in children 1 to 9 years, but also higher driver yielding, a practice where drivers must give right of way to pedestrians, is associated with fewer pedestrian collisions. However, from a pilot study that I conducted, more than 80% of drivers were not yielding to pedestrians, and this is the problem that I aim to address to enhance safety for pedestrians. So why is this study important? Road safety is recognized in the Sustainable Development Goals, specifically Goal 3.6 and 11.2, which calls for a 50% reduction in road traffic death and injuries by 2030, and this could be achieved through creation of a safe transport system. In terms of the research gap, most of the studies have focused on multiple unintentional injuries, leaving a gap in pedestrian safety research in Uganda, specifically limited research has been conducted on the effectiveness of school traffic wardens. In terms of the conceptual framework, the proceed model was applied and adapted for the thesis. And according to this model, a series of assessments or diagnoses precede the development, implementation, and evaluation of an intervention. So phase one in this model involves trying to understand the burden of pedestrian road safety problem in Uganda, while phase two looks at examining the contributing factors, which could be categorized as predisposing at individual level. We have aspects of low knowledge levels and attitudes, then reinforcing factors such as children being unsupervised, inadequate enforcement, then the enabling factors such as inadequate funding, gaps in legislation, among others. In phase four, in phase three, it involves assessment of the environmental, but also the behavioral factors. Behavioral factors could range from unsafe behavior, such as running and darting out. Then is the audience hearing? Okay. Sorry, I've seen a comment, they're not hearing anything. Then the environment includes aspects of the infrastructure. Then we intervene in phase four, which involves developing, but also coming up with an intervention to address the behavior factors in phase three. And the final phase is the evaluation phase in trying to understand the effectiveness of an intervention. In terms of the objective, I set out to assess the factors, opportunities, and barriers of child pedestrian safety. Sorry, just in a moment. Yes, so that was the overall objective. That was the overall objective, to assess the factors, opportunities, and barriers associated with child pedestrian safety, and to determine the effectiveness of the school traffic warden program. Specifically, I set out to explore road safety stakeholders' perspectives of risk factors, opportunities and barriers, to determine crossing behavior and associated factors, to determine the effectiveness of a school traffic warden intervention in increasing driver yield, but also crossing behavior, and to explore the barriers and facilitators that influence the implementation. A mixed method approach was utilized for this study. In phase one, I examined and identified unsafe crossing behavior qualitatively from sub-study one. And this fed into sub-study two, where I further investigated these factors, I further investigated this behavior to try and understand the factors associated with them quantitatively. Then in phase 3, I developed and implemented a school traffic warden program and to address the identified unsafe behavior. And in phase 4, determine the effectiveness of the intervention in improving driver yield in sub-study 3, as well as the facilitators and barriers in the intervention implementation. So that's how I hypothesized the studies and how they feed into each other. The null hypothesis states that implementing a low-cost safe-school traffic warden intervention has no effect on driver yield to pedestrians. And this is what informed the thesis based around this. In terms of the intervention of the wardens, this was identified through engagement with road safety stakeholders, who included representatives from schools, from ministries involved in road safety, the community, and parents. The wardens were largely non-teaching staff who underwent a training and were supervised by the school administration. They were veiled with reflective gear and stop paddles to help them regulate traffic. And they operated in the morning, afternoon, and evening. This study was conducted in Kampala City, and a sequential, exploratory, and analytic mixed method research approach was applied using both qualitative and quantitative methods. In terms of the ethical considerations, approval was sought from the Higher Degrees Research Ethics Committee, the Uganda National Council for Science and Technology. Additional permission was received from Kampala Capital City Authority, school administration on behalf of the pupils, and the Uganda Police Force. And the trial was registered under the clinicaltrials.gov. During data collection, participant privacy and confidentiality was maintained. For sub-study 1, where I set out to explore the risk factors, opportunities, and barriers to child pedestrian safety, 12 key informant interviews were conducted with road safety stakeholders from the Uganda Police Force, non-government organizations involved in road safety, the Ministry of Works and Transport, Kampala Capital City Authority, representatives from the drivers and the wardens. In addition, 6 homogeneous focus discussions were conducted with teachers and parents who were identified with the school administration. These interviews were audio recorded and transcribed. In terms of the analysis, I had to examine the words, the phrases, and sentences from the transcripts to infer codes, and similar codes were categorized together and themes developed. In terms of rigor and trustworthiness, member checking was conducted with the participants to validate these findings. So the key findings from this sub-study are, from the participants, they mentioned speed and alcohol as key risk factors. They mentioned speed and alcohol as key risk factors, as mentioned by an FGD participant. And this could largely be attributed to gaps in legislation, where we still have the speed limits in school zones higher than 30 kilometers per hour, and the blood alcohol concentration more than the recommended 0.05 grams per deciliter. Then also they mentioned risk-taking. Children are young, and this could partly be because their cognitive and physical abilities are still developing, and this makes them vulnerable. Then also the mentioned lack of segregation. We have a mix of mix of pedestrian with other means of transport because road systems prioritize vehicle mobility, and these findings are similar in other developing countries. In terms of the opportunities, they highlighted roadside enforcement, which is a deterrent to violations. And in fact, from a study by Bishai in Uganda, he registered a 17% reduction in fatalities due to police enforcement using speed radars in Uganda. They also highlighted road safety campaigns, sensitization going on in schools as a way of sharing key aspects in road safety, and an opportunity of the presence of these wardens and child supervision was also highlighted. In terms of the barriers, the key barriers that came up were related to funding as an obstacle, as highlighted by one of the key informants from the Ministry of Works and Transport. And this is contrary to high-income countries that have strong commitments and have integrated safety of pedestrians in their policies, plans, and budgets. Then limited political action, and yet from the recommendations, the global recommendations, government should take lead in road safety. And the last key barrier was gaps in legislation, where we still see the speed limits in school zones being higher than the recommended 30. Then in sub-study 2, where I set out to determine the child pedestrian crossing behavior and associated risk factors, this was a cross-sectional study conducted in 2022 among primary schools in Kampala capital, registered under Kampala Capital City Authority. And simple random sampling was used to select 21 schools from the 89 schools. The sample size of 21 was arrived at through the Bennett formula. And the key crossing behavior of interest included whether or not at the time of crossing, a child waited at the curb, looked both ways for oncoming vehicles, walked, or ran. Then in terms of data collection, for each of the schools included, 2 crossing points were identified, one that is near and another that is distant from the school crossing. And for each crossing, a mini GoPro camera was mounted to capture the crossing behavior of children in the natural environment. And this recording was captured in the morning, afternoon, and evening when children report to school and return back home. So at the end of this, the recordings were viewed and data on crossing behavior was coded and entered into a mobile device that had the Kobo Collect toolbox to aggregate all the information. And for each school, the statistician randomly selected 100 individuals from the recording. I also checked for multicollinearity using the variance inflection factors. And for association between the outcome variables, the running, the failing to wait at the curb, I use prevalence ratios with corresponding 95 confidence intervals using a modified quasi-regression model. I didn't have a main predictor variable, and so all covariates were included in the model to help us understand the variability of the outcome. So I present the key findings. From this, at multivariable analysis, we see that the presence of an obstacle, such as a parked vehicle, crossing alone compared to crossing in groups, and the absence of a traffic warden was significantly associated with a higher prevalence of crossing outside a crosswalk, which is an unsafe behavior. Of course, if there's an obstacle such as a parked car, it alters the navigation path of a child, prompting them to cross from elsewhere. Children who cross alone have no influence of an authority, and so they dart out impulsively. In terms of running as an outcome and multivariable analysis, children who crossed alone had a higher prevalence of running. Still, there's no authority to regulate them. Then, at multivariable analysis, drivers not yielding to pedestrians, the evening and morning period, and the presence of a four-wheeler vehicle at the time of a child crossing was significantly associated with a lower prevalence of running. And of course, we see that if there's a bigger vehicle at the crossing point, there's that perceived danger, and so they avoid. And also, if a driver does not yield to the pedestrian, there's also that perceived danger of a threat. And this study is available online. So for sub-study 3, where I set out to determine the effectiveness of a school traffic warden intervention, this was a 2-arm cluster randomized trial in 34 school clusters. Sample size was arrived at through the Rutherford formula. The intervention was conducted over a 6-month period, that is the second and third term in the school calendar year. And the key primary outcome was the driver yielding, and the secondary outcome was crossing behavior, which was arrived at through calculation of an index that categorized it into safe or unsafe. So simple randomization with a 1-to-1 school allocation ratio was used. I did not stratify. Then the intervention arm received both the leaflets and the treatment, which is a school traffic warden program, while the non-intervention arm received the road safety materials, and this is the standard of care. And I utilized the same methodology of video recordings to capture behavior. In terms of analysis, a multi-level mixed effect modified causal regression was used to assess the effect of the school traffic warden program for intervention on increasing driver yield and safe crossing behavior. The variables in the final regression model included the exposure variable, which was the treatment, the intervention, the school traffic warden program. Then variables that met the 0.2 level and by variable analysis. Then covariates such as sex, the time of the day, whether or not an obstacle was present, crossing in groups. So from this, we see that driver yield was 7.2 times more prevalent in the intervention arm compared to the control arm after adjusting for sex, period, whether an obstacle was present or not. And thus, we have enough evidence to reject our null hypothesis, which stated that implementing a low-cost school traffic warden intervention has no effect on driver yield. So there was increased driver yield because the wardens act by regulating traffic and reducing conflict. And similar findings have been reported in higher income countries by Rosenblum, who has done some work in traffic wardens. However, in comparison to other measures, there is a limitation in terms of the reach. The wardens are usually in a specific location. However, they offer immediate protection. For the secondary outcome, which was crossing behavior at multivariable analysis, the presence of a school traffic warden was associated with a 70% increase in the prevalence of safe-crossing behavior. And it's because they're viewed as an authority who deter unsafe behavior. And this study is also available online. The last sub-study explored the barriers and facilitators of this warden intervention, which was a qualitative study conducted among 11 school traffic wardens through in-depth interviews to share the experiences. We also collected information from school head teachers who documented their daily experiences over 6 months, and this was used to triangulate the findings. And I arrived at data saturation where no new information was coming. Apologies for the technology. So, kindly confirm if you can hear and see my screen. So in terms of the barriers, the wardens highlighted some safety concerns. There are situations where motorcyclists don't pay attention to their instructions. Then also the issue of competing demands. They're involved in other domestic work and other activities, which could at times affect their availability as hinted on by one of the traffic wardens. Then also funding was highlighted as a key barrier where the allowances that were given to them were not enough. In terms of the facilitators, the school traffic warden intervention was perceived to be an important initiative that ensures safety of children. One of the head teachers mentioned that we believe that traffic wardens saved children from road traffic crashes, and also the trainings that they underwent and the safety gear that they were availed was highlighted as a facilitator to help them perform their work, and also mentioning that they derived satisfaction from helping children to cross as highlighted by the warden. In terms of the study strength, for the quantitative studies, I utilized a large sample size, and data collection was conducted in a natural environment. I also had an opportunity to explore the implementation dynamics of the school traffic warden program. In terms of the limitations, with the method of video recording, I could not objectively measure the age and vehicle speeds, which were excluded, and this could be confounding the relationship. Then also I didn't explore temporal and seasonality effects. In terms of the conclusions, from this research, pedestrian road traffic injuries occur as a result of an interplay of multiple factors related to the behavior of children, the behavior of drivers, but also gaps in infrastructure, and a systemic challenge highlighted was the funding. But amidst this, the school warden program or intervention was associated with improving driver yield, but also improving safe crossing behavior. And the key successes to this intervention were the trainings that were conducted, but also the provision of safety gear. As I come to conclude, in terms of contribution from this work, the school traffic wardens are effective in low-income countries, and they improve driver yield and safe crossing, and should be promoted to supplement other interventions at school crossings. And considerations for implementing include trainings, but also providing safety gear and funding. In terms of the recommendations to the Uganda Traffic Police, they should strengthen enforcement of speed, but also driver distraction, drink driving. For the Kampala Capital City Authority, they should scale up this intervention in school zones. Then for the school administration, they should provide the materials and organize for trainings and do the day-to-day supervision. For future research, work around seasonality, having multiple data collection points, multiple data collection times of a period of time should be considered. Then also explore the role of other built environment characteristics, such as the traffic volume, assess the impact of the training we conducted on the knowledge retention, but also on the skills retention. Then also the impact of this warden program on road traffic injury occurrence beyond behavior. In terms of my contributions, I was fortunate to be nominated to be part of the Uganda National Road Safety Forum, where I contributed in the National Road Safety Action Plan 2021-2022, up to through to 25 to 26. I've also been invited to TV talk shows to share some of the work in road safety to make our roads safer, as well as contributing to newspaper articles. Lastly, I would like to acknowledge the doctoral committee and the supervisors, Professor Lina Tuyambe, who's here, Professor Ashley Baniakak, Dr. Nankabirwa, thank you for the support. Dr. Olive Kobusinje for the mentorship, thank you very much. The study participants who obtained information from the School of Public Health Communities, specifically the Department of Disease Control and Environmental Health, the Trauma, Injury and Disability team, the PhD forum, the peers who held my hands, the SEBA project, collaboration for evidence-based healthcare and public health in Africa that gave me the funding, the Erasmus program that gave me protected time, family and friends. I see my parents here, and this was a picture of me trying to write the thesis with happiness, which is a little bit strange, but yes, thank you very much. Over to you.
Thank you very much, Jimmy, for the presentation. Feel free to have some water if you need it at this point in time. It's been a good session so far, and apologies to you all for the technology glitch. Sometimes these things are unavoidable, but I hope to have a small rest of the session moving forward. I wish to recognize the presence of a doctoral committee member of the team that has worked with Jimmy, Dr. Olive Kobusinje, who has been instrumental in the journey, and I know she has been a part of the process right from the start. At this point in time, we're going to go into the next session of the defense, which is to have the examiners engage the candidate, and we shall start with the opponent, who is Prof. Mary Hasselberg from the Career Institute, to now spend a bit of time engaging Jimmy, and thereafter move on to the next examiner. Prof. Mary, let's check if you're able to now go ahead and have an engagement with the candidate. Prof. Mary.
Now, can you hear me?
Yes.
Can you hear? Yeah. Okay.
1, 2.
Is it fine? Okay. Hi, everyone. Hi, Jimmy. First, thank you for inviting me for the Makerere School of Public Health, for inviting me as an opponent. It's very nice to see all of you and also see some alumni from Karolinska Institutet. That's been nice. Jimmy, thank you for a very nice presentation, very informative. I have really enjoyed reading your thesis. And I'm very happy to see your interest and engagement in road safety, and especially in child pedestrian safety. But this, of course, also means that I have a lot of questions and issues that I would like to discuss with you. So I will have some overall questions and also some more specific methodological questions. But I would like to start with just writing your thesis, that your thesis have advanced the knowledge about road traffic injury risk among child pedestrians. Could you elaborate on that and give us some examples of how we have advanced our knowledge about risk factors for pedestrians, child pedestrians, and also say something about what is most surprising for you, what results are most surprising for you?
Thank you, Prof. And to start with, how my work advanced research in this area, I would start with, first of all, the methodology that I used. I utilized a mixed method approach, where I start by understanding the context-specific risk factors, and these could be multifaceted, related to the behavior, but also infrastructure, context-specific factors qualitatively. Then I advance to think of a solution on how to address the risk factors that I had identified. So key things that came up from the qualitative behavior were the fact that these children are young and they're from low-income settings and they need help navigating the road. Of course, higher income countries have traffic controls with technology, which may not apply in our settings. So sub-study 1 advanced our understanding of the contextual risk factors specific to Uganda. Then I also thought, through consultation with stakeholders, came up with modifying the low-cost school traffic warden intervention, not to replace,
Now I think I lost you a bit, or the last part.
Can you hear me now?
Yes, yes, yep.
Yes. Then I came up with a low-cost intervention that showed that school traffic wardens play an essential role in advancing and helping in road safety in this area. So that's the contribution I made, but also understanding the implementation dynamics. For effective implementation, some of the safety concerns have to be addressed, among others. And in terms of what is surprising from my work, I think in comparison with other contexts, I found out that this intervention works. Remember that our traffic mix and composition is different from higher income countries. We have commercial motorcyclists and other road users. Thank you, and over to you.
Yeah, thank you. So if we look at the risk factors that you came up with, speed and alcohol, risk-taking, and lack of segregation, is there any of those that you could have guessed beforehand, before you did your studies, or was that surprising that that came up in the study one?
So from literature, these have been highlighted to be key risk factors, but I went into the research with an open mind to uncover some of the things that came up. And of course, when it comes to alcohol, I identified other aspects in terms of the blood concentration levels here in Uganda, which are way different from the international best practice recommendations.
Okay. I think it's interesting that you have a mixed method approach and you have an exploratory mixed method approach. Did you think about the possibility of having a more explanatory mixed method approach, or how did you decide to have this exploratory mixed method approach?
So for the exploratory mixed method, in this, you start by qualitatively understanding the behavior from interviews with road safety stakeholders. Once you qualitatively understand these behaviors, I go ahead to try and see quantitatively if this behavior are associated with the factors identified qualitatively. So the proceed model is what guided the conceptualization of the study. However, from the interviews, we also uncovered rich information that would try and help us understand the quantitative findings. So there are also aspects from the data that can help us explain why the traffic warden worked in a way of triangulating. Thank you, and over to you.
Okay, thanks for that. And then you used the proceed model, as you explained in your presentation, in a very good way. I thought about that you don't have a social assessment. It's usually also included a social assessment step in the proceed model. Did you think about that, or did you discuss that, a social assessment, which is more quality of life, or how people perceive safety, perceive injuries and health?
So for that phase, I utilized existing work that has been done. There is a desk review that I participated in, and there was also a study that used police and health sector data. So for the model, I started from the phase of the contributing factor assessment and identifying the behavior, then coming up with an intervention to address the behavior. But it would have been good to consider it as an independent component in the study. Thank you very much.
Okay, and the health behavior, now you talk about the behavior and change of behavior. What kind of theory would you say that you used for the behavior change?
So in trying to understand behavior, I relied on the Piaget who studied behavior of children and looked at behavior as along the stages of growth. For instance, a child younger than 2 years relies mostly on a caretaker. They are unable to anticipate the consequences of their actions. Then children in the pre-primary have developed risky behavior. They tend to dart out impulsively, and this makes them vulnerable. So that is the theory that informed me in trying to understand child behavior, but also vulnerability. But I'm happy to hear more suggestions. Thank you.
Okay, so you didn't aim to change the behavior of the children. That's what you're saying now, because it's very difficult to do that due to their development and so on. So what would you say that the intervention aimed at? If it's not to change the behavior among the children, is it some other behavior that you aim to change with the intervention?
So I could approach it in 2 ways. The intervention came in to try and help the children safely cross. But I identified some behavior such as road darts, a child darting out impulsively, issues such as waiting at the curb before crossing, running while crossing, which is hard to change. But a warden comes in to reinforce and stop that kind of action at a point of crossing to ensure that they are safe. So the intervention came in to try and help reduce the vulnerability as they are crossing. I'm not sure if I've answered it well.
No, I think I'm aiming at the proceed model also. Sort of, is a help to guide what you want to change. Is it a behavior, or is it an interaction, or what is it, organization, or what is it that the intervention want to change? And then you also talk about the driver yelled. So the gelding, is that something that the intervention is aiming to change in a way, or?
So driver yield was the primary outcome. And this is a practice where the driver must give right of way to pedestrian. So in our context, that has been violated. In fact, these crossings have been, from research, are risky. We've had some crashes registered from there. But this intervention had that immediate control of traffic. By raising the flag using a whistle at a school zone, drivers were prompted to come to a complete stop, and then the children were signaled to cross. So for driver yield, it helped in reinforcing driver stopping. And of course, in other high-income countries, in terms of legislation, these crossings are respected, which is not the case here. So I was trying to think through contextual solutions as we wait for more permanent interventions. But this supplements with the overarching objective of ensuring that the children are safe.
Okay. And this intervention, the traffic warden program, it was not really clear to me why you chose that program or that intervention. So can you say that again or elaborate on that? Why? I mean, did you have other interventions to choose from, or did you discuss different approaches or different type of interventions?
Okay, thank you very much. There are various interventions that are available for pedestrian road safety. But how did I arrive to this intervention? I first of all did sub-study 1, which was qualitative, and the aspect of school traffic wardens kept on coming up as a solution around school zones to supplement the other engineering measures in place and reduce the problem of conflict at the school zone. So I further consulted with various stakeholders involved in road safety, ranging from representatives from the schools. I spoke to school teachers. I spoke with the parents. I spoke also with representatives from the line ministries, and this is how I arrived at it. And I also looked at literature, and Rothman had done some work around school traffic wardens in Canada, and they had some surprising findings. And so with all that information, this is how I arrived at this intervention to try and generate information. And besides that, this intervention is quite common in our setting, and we did have sufficient evidence on it. Thank you very much, and over to you.
Yeah, I think it's an interesting choice of intervention. So, but it's, as you say now, it's mainly based on the people that you interviewed, the stakeholders, and you interviewed school teachers and parents and other stakeholders, but you didn't interview children. And that's also something that you bring up as a limitation. Was that something that you discussed, the possibility to involve children, or say, ask children about their risk factors or how they perceive their school environment or their road environment outside schools?
Thank you for raising that interesting concern. Indeed, it would have been good to get their perspective. However, from the recordings, I was able to generate additional information on the crossing behavior in a natural environment. So I could see how they interact with the vehicles, whether the drivers are yielding, and that is what supplemented them not being interviewed. And also besides, the primary school children are quite young, especially the lower primary. And so I had to rely on the parents and teachers who are in close contact with them in their everyday routine, and they would give an account of the challenges that they face on the road. But I have noted that. Thank you.
Yeah, I think it's interesting that there are some studies that have shown that children also can point out hazards and risks in their environment. So that's also why I asked that. So, but of course you can also, like you have done, you can observe them. And I think that the video recording is an interesting choice of methods that you have used. But talking about the study from Toronto and Rothman and colleagues that have done that, they did not find a significant change in collision risk in their studies. And obviously the context is different, but why would you say that it's different from your study and the study in Toronto?
So yes, the contexts are different, and the outcome is also different from mine. They were looking at injury, I was looking at behavior, which could be a proxy. But from their study, these wardens were placed at high-risk places, which is different from us. For us, we place them within the school zones where there are already some partially existing measures. So the discrepancy could be as a result of positioning them at intersections, which could be a high risk. Thank you.
Would that be interesting to look at that also in Uganda and Kampala?
Yes, I would consider also looking at that and see how our findings compare to that in Toronto. Thank you very much.
I would also like to ask some questions about the control group. You said that they had the standard of care, but what do you mean by that? I mean, what did the control group have? What did they get?
So we have the National Curriculum Development Center that is involved with designing curriculum for primary schools. And they have materials of road safety that they want to integrate to some extent in the school curriculum aspects of road safety. So I used that material that had aspects of road safety, and this material, I distributed them to the 17 schools that were in the control arm, but also I distributed these materials to the intervention arm in addition. So I didn't want to do nothing in the control arm. As a best practice, I worked with what is currently available.
Okay. And what difference did you expect between the control and the intervention arm?
So the difference between the two, I wanted to see if my outcome of driver yield was driver yield in both the schools that received the warden was different from the schools that didn't receive the warden. So I designed it as a cluster randomized trial to test this intervention between the two arms, such that I can confidently attribute the change in driver yield to the intervention after controlling for other covariates.
And was that what you expected beforehand? Did you discuss the effect that you would expect?
So I went in with an open mind. Of course, when I read Rothman's article and I saw some contradicting information, I decided to go in and see what the data says.
Okay.
Yes.
I would also like to discuss if there are some ethical considerations with this intervention. You have raised some issues about the traffic officers, that it can be some consequences for them, but could you discuss the ethical considerations about the intervention or implications?
So thank you very much. In designing this intervention, I had to ensure that the wardens are stationed in at crossings that are safe with some partially existing interventions. So they were within a school zone where the speeds are already reduced to some extent, and there are some partially existing measures. However, the problem comes in when it comes to right of way. The drivers are reluctant to wait. The children crossing are also reluctant to wait, and that conflict results into crashes. So against that, these wardens were placed at places that are safe. Otherwise, that's how I conceptualized it, to avoid ethical considerations if something happened to them.
And what about the responsibility of the traffic warden if something happens to a child?
Say again, I missed you there.
If the responsibility of the traffic warden, if something happens to a child, if the child is hit by a car or something.
So that's a good question that you raise. Who is responsible? So I'm coming in from the point that many of these children come from low-income households. Their parents just prepare them in the morning, tell them to make a line and walk to school. And then they go and try and look for money to sustain the families. So these children are left on their own. And we cannot sit there and do nothing. And we need to see that we think through solutions, come up with interventions to contribute to pedestrian safety. So I came in from that angle that we need to do something at the moment as we wait for more interventions. But we do not have policies around insurance, and that came up as a gap. But I know the Kampala Capital City Authority is in discussions of having traffic wardens recognized by policy, and also violation would attract a fine. And with this, then some of the offenders will be held liable. For instance, if we had a policy or legislation around that, if a warden flags you down and you hit a child crossing, that would be an offense liable by punishment in court. So we're in the initial stages of generating information that can see that these wardens are institutionalized, and policy and legislation is came up. They come up with legislation and policy to see that they're integrated and ethical issues will be addressed. A mouthful in my response, but thank you very much.
Yeah, I think it's. I totally agree with you that something has to be done, and it's a problem that we need to solve in some ways. But at the same time, when you make research out of it, you have to also to discuss different points. And these traffic warden, they also have now a work situation that might be stressful or might include some ethical aspects that are important also to discuss. That's why I brought it up. So you also talk about generalizability of your studies. How would you say that your results can be generalized to other countries?
So this study was conducted in Kampala, that is in the primary schools registered in the Kampala Capital City Authority. In terms of generalizability, of course, these findings are generalizable to the public primary schools in Kampala. But if we were to look at our setting as low-income countries, the settings are more or less the same in terms of the traffic mix, where we have multiple road users sharing the same space. And these findings would be generalizable to similar settings with the same traffic mix and road environment as such in Kampala.
Okay, yeah, I would agree on that. You had no sex difference in study 2 and 3. You didn't show any difference between boys and girls? I guess it was the sex of the pedestrians, or it was not clear to me, but you had.
Oh, yes. When it comes to behavior from the international literature, there's a difference in behavior where we have boys exhibiting riskier behavior than girls, or males exhibiting riskier behavior than females, which was not the case in this research. One of the explanations to this would be the age of the participants, the age of the school-going children. This, irrespective of whether they are male or female, as long as they are young, they are still vulnerable because of their cognitive limitations, because of their physical limitations, and the risk was not different between the two, and that could be one of the explanations to that surprising finding.
So you would say that the risk behavior, or the differences in risk behavior, is not shown for younger children. That's what you say, or?
Again,
That the difference in risk behavior between boys and girls, is that not shown for younger children?
yes, partly because of those cognitive limitations. A classical example is if we're to look at a boy or a girl of 6 years, they are unable to appraise the risk, especially when they are confronted with a complex traffic situation. We have cyclists, we have private cars, we have larger vehicles. There is no difference in behavior. They are all vulnerable because.
Okay, so you talk more about the vulnerability of the children. So maybe that's more on the driver's side then? Because I guess that I mean, there are studies that have shown that quite young children also have differences in risk-taking behavior. Now you can't hear me, or did you lose the? No, I can't hear you now. Now you're muted. Okay.
Progress.
Sorry, I missed you there. We
Okay.
had,
Yeah. Okay, but I think that time is running, and I would like to give some space for the other examiners. So I would just like to end with something that you can, if you would give us 2 take-home messages from your thesis and from your research that you have done. Would that be 2 take-home messages
from
for us?
4 years in this year. on the 4 years in doing this work, my key takeaway is that children are young and they need help crossing the road. We need to think through interventions that protect them and shift the risk away from them and not hold them accountable for their unsafe behavior. So road safety planners should be held accountable for safety. Then secondly, school traffic wardens supplement existing interventions to reduce that conflict at school zones that already have partially existing measures. Thank you very much.
Thank you so much, and thank you for the discussion, and good luck with everything in the future.
Thank you.
Thank you very much, Prof. Murray, for the time you spent engaging the candidate. I'm sure he has also appreciated the insights you've given into his work. We now are going to move on to the external examiner, who will also spend a bit of time engaging the candidate, and that is Dr. Megan Prinsloo from the South African Medical Research Council and the University of Cape Town. Dr. Prinsloo, let's check if you can hear me and you're good to go at this point. Dr. Megan, are you there? Okay.
No.
Give you a few minutes to get sorted. Hopefully we'll wrap up in this.
Well, Megan, what's the name?
Thank you. Can you hear me?
Yeah, we can hear you now.
Okay. Seems I can also turn the video on.
Yeah.
If there's any interference, I'm happy to switch the video off. So just let me know.
Yeah, good for the video only be on for now.
Okay.
Over to you.
Okay. Thank you. Hi, Jimmy. Nice to see you face to face, and thank you for the presentation. I've given you extensive comments during the external examination, some of which I can see you have incorporated into your presentation. So thank you for that. And I do think that your study provides a very valuable contribution to understanding the context in low and middle income countries with regards to road traffic injuries. I want to start just with, Professor Hasselberg's covered the methods and some of the results extensively, but I want to start with the general question around how statistics are collected, death statistics in Uganda. You mentioned in some of your introduction that you don't see a decrease, you've actually seen an increase, I think it was since 2018 up to 2022 with regards to road traffic injuries and deaths. So I want to know how the quality of the information is with regards to road traffic death statistics in your country.
Thank you very much. Data on road traffic crash statistics comes from the Uganda Police Force, which is mandated to routinely collect this data and have it published. There is a study we did on trying to compare what the police reports, what the WHO reports, and in this study, we went and collected health sector data. We collected data from the morgues and tried to compare it with the three, and we noticed some discrepancies. Of course, there are data quality challenges in terms of the completeness, in terms of the capture methods. WHO uses models, and their numbers are up to 7 times what we report in the Uganda Traffic Police. However, irrespective of the data quality challenges, we still have an indication of the problem of road traffic crashes with the available data. Both what we found, what WHO reports, and what the police reports shows an upward trend. Thank you.
Okay, and how do you think it can be improved? How do you think the quality of the death statistics in your country can be improved to properly monitor the progress to meeting the SDG targets?
So it could be a multi-pronged approach. First of all, our setting is different. If a crash happens up country, the reporting police officer goes and captures that information, writes it on a paper, then it is typed out. We don't even have the coordinates captured. So there's a lot of rich information that is missed out. Would suggest rolling out the digitized approach of collecting data, ensure that coordinates are captured, then information on the demographics, the cause is also captured and submitted to an aggregate server. So we could utilize ICT that we could pilot and see how we can have this routinely collected as opposed to the methodology that's being used. However, we still get some information on the burden with our methodology.
Okay, thank you. According to the Global Road Safety Report, we've seen some of the largest declines from the European region, and they've actually reported an increase in road traffic deaths for the African region. However, we do see some success stories. For instance, in Rwanda, there's been a significant decline in road deaths. Do you think there are any lessons from Rwanda that you can implement in Uganda in order to reduce the deaths further? Although, taking into account that Rwanda does have a much lower or smaller population than Uganda and South Africa, for instance.
Thank you for raising that. In 2016, from the global status report, then when I looked at the death rates between comparing Uganda and Rwanda, there were about 29 per 100,000. But over time, that has changed. And what we can learn from Rwanda is the enforcement. There's a study that was done in Rwanda trying to assess the effectiveness of enforcement coupled with other. Can you hear me?
Yes, I can.
It's okay.
Can you hear me now?
I can, yes. Can you hear me?
Yes.
Okay.
There was a study done in Rwanda evaluating the effectiveness of enforcement. A similar study was done here in Uganda to evaluate the road safety campaign that we termed Fika Salama. And it showed significant reduction in the road traffic injury burden. So there's a lot to learn from other countries and see how this can be replicated. Thank you very much.
Okay. What did you say are the challenges with regards to gaining political will for road traffic safety in Uganda?
Say again, I missed you there, sorry.
What are the challenges with regards to gaining political will with regards to road traffic safety in Uganda?
So I think one of the barriers as to why we have not gained traction in terms of political action would be linked to the priority we attach to road safety. From the desk preview that I did, and also interacting with 3 interviews with representatives from the Parliamentary Forum for Road Safety, they highlighted that road construction prioritizes motor vehicle mobilities. I think the focus is on the kilometers of road constructed as opposed to safety. So one way of garnering political action would be firstly to involve the decision makers, and we as researchers from inception should work hand in hand with the decision makers such that they are involved, and when making decisions on interventions, they use what has been proven to work as opposed to expert opinion.
Okay, thank you for that. I've noticed in your thesis that you mentioned that the public health approach should be combined with Haddon's matrix in response to road traffic injuries. Can you perhaps elaborate on this for me?
So, as I attempt to answer, injury frameworks help us to comprehensively understand the problem and come up with solutions. So the Haddon matrix looks at aspects of the epidemiological triad, that is the host, the agent, and the environment on one axis, and then a time interval of the pre-crash, crash, and post-crash. So one of the limitations of the Haddon matrix is that it stops at identifying the interventions. But the public health approach has an added benefit of developing, implementing, and evaluating what has been shown to work, which is why I suggested complementing the two. Just the surveillance phase, it has the intervention, implementation phase, then the evaluation. So one of the gaps in road safety research is that the interventions that have been implemented are not evaluated to see how effective they work, and also aspects of cost need to be done. So this is where the frameworks come in handy. Thank you.
Thanks, thank you. I would like to know, in terms of your findings, Jimmy, which of the key components of the safe systems approach does your findings inform?
So if we are to look at the pillars that have aspects of a multimodal transport system, if we are to look at another pillar of safe road use and a pillar of safe infrastructure, then safer vehicles. From my research, aspects of the safe road use behavior were identified. The risk factors had implications for enforcement, which are aspects of that pillar of safe road use, but also gaps in infrastructure were highlighted, issues around road safety management when it comes to aspects of political action, seeing to it that we have policies that advocate for investment, funding the authorities that are managing road safety. So that is the linkage I could share in regards to my findings and how they fit into some of the pillars of the safe systems approach.
Okay, thanks for that, Jimmy. I just have one more comment or question for you. You referred to the blood alcohol information, and I'd like to know whether you have information on that captured in your country. You mentioned that it was identified as a risk factor, but it was a perception of one of the focus group participants. I'd like to know, how do you have regular blood alcohol testing data available for you to be able to make this inference?
So from the global status report and some of the global efforts, they recommend a blood alcohol concentration level of less than 0.05 grams per deciliter. In terms of legislation, there is legislation available. However, our limits are higher than the recommended. So from the interviews, they highlighted aspects of alcohol use while driving to be a risk factor. Then how is this information collected? I think there was a pause during COVID. The police uses breathalyzer tests, but I think during COVID they had stopped using that test, but that's how we capture that information.
Okay, and what is the limit? What is the limit for blood alcohol in your country?
I could be corrected, but it is 0.08, must be 0.08, but I will verify. But it's higher than the 0.05. And for novice drivers, they recommend 0.02. However, ours is much, I believe is much higher than that.
Okay.
But I will verify with the statistics.
And would you say this is a gap for future research in your country, and how would you approach it?
Yes, this would be a gap. I think there is need to revise the legislation around blood alcohol concentration limits to match or fit the international best practices. Then there are implications around enforcement, and that's what I would recommend.
Okay, thank you, Jimmy. This was a wealth of information, and good job in sharing it today. Thank you.
Thank you very much.
Thank you very much, Dr. Prinsloo, for that time you've taken to engage the candidate. We are now moving on to the third examiner as part of the team, and that is Dr. Wilson Mwezi, who is here with us in the room, who is from the Department of Psychiatry at the School of Medicine, Makerere University, College of Sciences. Over to you, Dr. Mwezi, and feel free to occupy that seat as you engage the candidate from there.
Hello. Okay. Thank you very much, Chair, for giving me the opportunity to have an interaction with the candidate. And I do not take this opportunity lightly because it is an opportunity to have an interaction. And for me, issues of related to traffic, road traffic, and the incidents associated with the road traffic is personal. It's not just academic. For your information, I lost a son who was 22 years of age. He was hit by a motor vehicle near Kamocha police station. I lost a wife on Gaga bus coming from northern Uganda. I lost a father on the Maram roads of Kampala. So it's more personal for me when we talk about traffic and this consequences associated with road traffic. So this reading through this dissertation gave me those memories of what happened and what has become of who I am today. I will not stick onto that, but just give you context. But also congratulate you on reaching this stage. I think I've had an opportunity to read the thesis and point out a number of things which may have been brought to your attention so that you can improve your thesis. But even after that, I was given an opportunity to look at the different perspectives by the different people that looked at the book, and also give an opinion on whether you had to comply with the requirements of what you ought to have done. And in spite of that, I have a few really issues to raise for purposes of you clarifying. You are the expert in this, I may not be the expert. One of the things I wanted for you to give a comment about, I may not recall the specific page, but that there was in your statement of the problem where you seemed to indicate that you had to engage, or your research assistants had to engage in inconspicuous filming, doing the filming for purposes of data collection, and I seem to have an issue with inconspicuous filming. Is it ethical?
Okay, so thank you for raising that. The practice was that once we identified a crossing, a mini GoPro camera device was placed at an elevated position to capture information on crossing behavior in the natural environment. The interest was to view that recording at the end of the day and see what happens. Similar to what the traffic police does, they put cameras along public spaces and capture information. So that was what was done in practice.
Okay, thank you very much for that. It's like it's not something that's out of the ordinary. Other people, different professions do that. I do find out I did find out as I read through your work that you had quite a number of research designs or methodologies that you deployed. At some point, I saw a qualitative research study design where you had informant interviews and in-depth interviews, and you seem to tell us that you used the thematic analysis. Then you had a cross-sectional survey at some other point based on the video observations. Then you had a cluster randomized trial. And I was like, oh, this is too much. Can you tell us, why did you use all this? Why not one or two? What were you trying to achieve?
Thank you for raising that. So design. Then what can we do about this unsafe behavior that have been identified? That's why I come in with an intervention to see how it improves the behavior. And it was informed by a cluster randomized design. The intervention was delivered at school level, at cluster level. Then lastly, I wanted to understand some implementation dynamics of the intervention. And that's how I came in to interview the wardens to share their lived experiences. So the approach I used was based on that framework. So each sub-study had a unique design.
Thank you very much for that explanation. I also see somewhere that at the end of 6 months, you had 11 in-depth interviews. You conducted 11 in-depth interviews. And and then you had 4 key informant interviews. And I was like, why 11?
Why 11?
Or why 4?
So the objective was to understand the experiences, to understand what challenges are they facing. So I started by interviewing them. And after interviewing, I analyzed. So key codes started coming up, such as the safety concerns. They mentioned that. They mentioned conflicting priorities. So as I progressed through up to 11, I noticed that the same information was recurring. Even when I looked at the code count, they kept on, the codes kept on recurring. So I further decided to triangulate that with the head teachers who were the supervisors. So at the end of the day, they report to the head teacher, they share their experiences, and the head teacher documents that information for the intervention period of 6 months. And I went to the first teacher, they kept on bringing up the same issues, the second, the third, and the fourth. So that saturation informed, can I call it the sample size? Informed that sample size, yes.
Thank you very much. Now, now having done this work, wonderful work, by the way, which makes very good reading, but I think also has implications which, if taken up by the relevant actors in this area, would make a very big impact. So having done this wonderful work, I'm wondering, I am asking myself about the implications of this study. What, in your view, are the implications, both one for training, 2 for policy, 3 for practice implications, policy implications, research implications. What do you envisage since you've been immersed a lot in this work? What can you tell us?
So thank you for raising those key aspects on the work I have done. So of course, there are implications around policy. For instance, the fact that the school warden work is not yet integrated. There is need for KCCA, Kampala Capital City Authority, come up with guidelines and policies on how they will work, how they will be remunerated and deployed from this work that I've done. Then also the fact that training and provision of supplies such as the reflector wire, the stop signs, help them perform their job well. There is need for routine training of wardens, and the schools could take up this as a recommendation. Then in terms of research, I think further research should look at the direct effectiveness of these wardens in reducing injury occurrence. I measured behavior, but it will be good if we have routinely collected data. Say if they're deployed in January, we collect information over 3 to 5 years on the injuries averted, then also the cost effectiveness. Yes.
Thank you very much. As I said from the beginning, I have interacted with your book quite some time, and I was requested also to again give an opinion by summarizing the different commentaries that were put together by people who marked your dissertation. In my view, I want to believe that you did justice to the work that you signed up to do, and that I think again, in my view, I may not be an expert in this area, but in my view, as an informed person, I think there are significant contributions that are coming out of this one that has very good implications for science, for research, for training, for capacity building, even for advocacy for that matter. So allow me to congratulate you upon doing this work. And this is the first time for me to meet you and to hear you speak. You speak very well. Thank you very much.
Thank you very much, Dr. Moezi, for the time interacting with the candidate, but also for complimenting him for his work. I've seen his smile for the first time after complimenting him this morning. So I think he deserves that after 4 years of PhD work. Okay, so moving on to the next phase of the session, where we are now inviting the public to also engage the candidate, both those in-house, but also those who are online. For those online, you have a chance either to type your question in the chat, or if we get a chance, you will raise your hand virtually, and we'll be able to give you a chance to ask a question. And I'm going to invite Bonnie to help us with the mic here for those who are going to ask questions from within the auditorium. So members who are within the room here, if you have any question or comment or concern, please raise up your hand. I can see Dr. Senyonjo Alosias at the back, as any others prepare as well.
All right, thank you, Chair. Thank you, Jimmy, for this work. Mine is a reflection for Jimmy. In this interaction with the wardens, do we see an opportunity for the pupils, the children, also to develop some capacity like in their curriculum or in their peer groups? What could be the value in that regard for enhancing the safety of these young children? Thank you. You interacted, the intervention focused on the wardens, but I was asking about the literacy and ability of the children themselves to at least know about road safety. And if there is an opportunity, maybe further work to look in enhancing their literacy, but also agency to be able to negotiate as they move through these roads. Thank you.
We can take a few more, then you respond at once. Yes, Solomon.
Yeah, thanks a lot, Jimmy. So was the study now focused on school children? What is the incidence of road traffic accidents in school children? And could we use the same approach for the general public using wardens around traffic signs and so on? Thank you.
Let's take these two hands here.
Thank you very much. We are two people here. I am the biological father of Jimmy, and he has also the mother here. So I will ask my question, and Mama will also ask her question. So when I came for this PhD thing, I thought it would be very bloody dangerous. And I did not see much danger, I did not see any blood. Special professor, you know, it was really calm and good. So my thing is this. When attending one training, there was a professor introduced the training, and he had a PhD in poverty alleviation. So I was interested because poverty is actually, you know, torturing all of us. So I looked him up, and later I said, Professor, I think if for me I had just a, a certificate of attendance, I would be okay. But you have a PhD in poverty alleviation, which means you're okay in your household. Professor Pass kept quiet like the old two for some time. Then he said, poverty is a very stubborn thing. Even in my household, there are pockets of poverty. I was shocked. So tonight he has getting a PhD in this thing, of heart. So you would think that children from where it comes from, our children's children would be immune from that thing because he has a PhD. So I would want later a comment from him. Then secondly, PhD is a very high thing. When I look at it, I don't even see it. Is there anything else that can be awarded after PhD? So in this particular case, Jimmy, is there anything you want to add to your PhD? Or is there anything other people can add to this PhD? Thank you very much. Over to your mother.
Thank you, Mr. Chair. Mine is a short question to Jimmy. Jimmy, what challenges did you face during the PhD journey? Thank you.
I suggest that you answer those questions, Jimmy. Then we'll get another round of both people in here and then we also online.
Thank you, Dr. Senyonjo, for your question. Yes, indeed, further work needs to be done to increase the literacy levels for the school children. But this intervention was designed also in such a way that the wardens also would pass on road safety information to the children. So they were also used as a vehicle, but would also use them directly. Then in terms of the incidence of road traffic injuries, So the data that I have is routinely collected, and there's still some gaps. So the information I have is the actual numbers, for instance, of all pedestrians with the account for the about 1,500 of the 4,580. But I looked at the KCCA reports. We just had actual numbers of 17 deaths vis-a-vis 57 injuries. But it would be good to design a study that collects the incidents. And injury occurs, they capture that. But we can have further discussions after this. Then, thank you to my dad, a philosopher in making. Yes, there are other levels after this. There's a postdoc that I could pursue. But most importantly, this work also makes a contribution to the existing efforts that are out there. Road safety is a collective effort. It's not only us in academia, but we need to work closely with the ministries, the NGOs, to see that we alleviate these road traffic injuries. Challenges, thanks to my mom for asking that question. She told me she had been rehearsing for the past 1 month to ask that question, and I was scared. She kept on telling me, I'm rehearsing. So yes, the key challenge was the delays I experienced during the entire PhD. I was supposed to start data collection in March of 2020, but because of COVID and my interest were the school children and schools were closed, I had to wait for 2 years to start the data collection. So to me, that was the biggest challenge, the delay. Okay, thank you.
Thank you so much, Jimmy. I can see we have a few hands online. Let's go to the online people, then we'll come back to in-house. Prophet Peter Waiswa, if you're there, please go ahead and ask your question or make a comment.
Hello, Jimmy. Congratulations coming this far, and Professor Hasselberg. Nice seeing you continuing to build capacity in this space. Jimmy, there is a professor from Switzerland who says that actually road traffic accidents are right now the leading cause of death in Uganda, and that they surpass malaria. He's a very, it's not done the survey. Many of you not done is the one who led most of the work around system thinking and more. And he says the only problem is the way we are doing the coding for cause of death. Would you like to comment on that? Thank you.
Thank you, Prof. Waiswa. We have 2 more hands at the moment. Nathan, can you go ahead and ask your question or make a comment?
Okay, thank you so much, Chair, and congratulations, Jimmy, upon reaching this stage. Mine is a comment, especially on technology and innovations, Jimmy, because these are also quite critical when it comes to road safety. So my comment is, one is on maybe as you move this forward, you also need to look at the effectiveness of pedestrian detection systems within vehicles and how they could contribute to reducing accidents. And then also look into the impacts of smart traffic management systems on pedestrian safety. These would be also critical given that some of these technologies and innovations are very important in terms of how we could deal with safety issues. Thank you.
let's have Jimmy answer those two, then we'll take it on from there.
Thank you very much. I will start with Nathan. Yes, there are vehicle technologies to improve safety. We have the active technologies such as the crash avoidance systems that you're speaking about. And we also have the passive technologies. In the event of an accident, there are seat belts and all that. And it will be good to navigate this area, given that we're having some penetration of these technologies and we have some vehicles in the market. Thank you, Prof. Waiswa. I missed the question, but one thing that I got is that road traffic injuries and death have surpassed most of the infectious diseases, HIV and AIDS, in terms of death, which is true, but I missed what your question was.
Sorry, I was not trying to unmute. The question is, this Professor Don DeSavage claims that road accidents are the leading cause of death in Uganda, in Kenya, and I think there is one other country. And he said the problem is the way the cause of death is coded. You know, when you're coding cause of death, you must do the right way in order to get the right cause of death, but it is not properly recorded as the cause of death. So many people would say head injury, but not record it as secondary to road traffic accident. So what do you think about this epidemiology as reported by this professor? Do you also agree that road traffic accidents are the leading cause of death in Uganda? And do you know how the coding of death, or how it is done, whether it is systematic?
Oh, thank you very much. It's true we have data quality challenges when it comes to the classification of injuries. There are guidelines from the International Classification of Disease that should be followed. But a case in point is that once maybe an injured person is transferred to a clinic, they could misclassify the cause, and that could be maybe contributing to the statistics. So this is an area that we've tried to work on in terms of the capture of the variables in the event of a crash. What was the cause of death? What was the nature of the death? What was the age of the person? There's a lot of missingness. But irrespective of that, of course, the WHO uses models to come up with their estimates. It still shows that based on that data, it is the leading cause of death in young children. That's the comment I could make at the moment, but we could have further discussions in that space. Thank you.
Thank you, Jimmy. Let's have a couple more people online give their comments, and then we return to those in the room. Richard, can you go ahead and make your comment?
Okay, thank you very much. And thank you, Jimmy, for your presentation. This is a very interesting study, and I think you've done a good job to it. I'd like to understand, because like you have noted that traffic injuries is the leading cause of young people aged 5 to 29 years old. And given the fact that you've done this study and young people are part of those that are affected, I don't know to what extent you've been able to engage them and and how much they've been able to inform your study, whether you have had some interviews with them and interacted with them, because what we see right now, and probably why we see the numbers of young people being the most affected, is because of not majorly, but one of those that we could think of would be they are not involved. You know, they are not involved. They are not engaged, and as you know, young people have a way of communication that is not the same as the adults. So they have a unique way of approaching things that until we get to their level, their understanding, it might be hard for us to pass on information. That is why all the policies that we talk about, the laws that we talk about, they don't understand them, and they're not probably sensitized. We don't break down this information for them to understand on how to use them. That is why they are increasingly probably being affected. We're not giving them a place at the table to express themselves. And I don't know if you have been able to give them that space to express their part and their challenges that they face on the road every morning. They come to school, and every afternoon or evening as they get back home. So because I would feel that could maybe give us, you know, an informed view on how we can approach them better, or design our awareness and sensitization in a certain way, or come up with a certain curriculum that maybe will add on to what the Ministry of Education has, and as far as you know, road safety is concerned to these children. And if you did engage them, then probably what gaps did you find them having that you have maybe thought of certain trainings or you know, made certain recommendations that can help us improve their behavior? Because I am certain that much as we have these risk factors, the alcohols and speeding and what, there is also a behavioral issue that the young people probably have. How better can that be addressed? You know, how has your study, you know, come up, you know, to address this behavioral aspect of the young people, so that we can reduce the existing, you know, issues that are affecting them, and as far as the traffic injuries are concerned. Thank you.
Okay, thank you very much, Richard. We have a couple more hands. Mr. Kaliwang, if you're there and you're ready, please make a comment. And try to be brief and to the point.
Okay, thank you very much. Jimmy, thank you very much for your presentation. Very informative study, and it is quite exciting. And I'm sure the results are going to inform not only policy, but also our practice. I only had one concern when you talked about alcohol, and you hinted on it that drivers and their levels of alcohol in their blood, whatever, is higher. But children cross roads during the day. Police usually does breathalyzer testings at night. Would you think drivers remain drunk during the day? Could we have gotten different results if at all you were to test the drivers after crossing the cameras and see whether they are having any level of alcohol during the day, or levels of alcohol at night could probably be different from during daytime? Thank you very much.
Thank you so much. Let's get the last comment from the online group for now, from Rose. Over to you, Rose.
All right, thank you very much, Chair, and congratulations, Jimmy. You make it sound easy for many of us. Thank you, well done. I hope as you continue to work in this area, for us that treat the victims, that all the children that come in take this very passionately. So we appreciate that effort. And I also understand that there are very many angles to this. And as you rightfully say, this is part of it, is contributing to other work that is done. And I pray and hope that as you continue with a postdoctoral, you should also consider children with disability or young people with disability, the challenges they face. Thank you very much.
Thank you, Dr. Rose, for raising the issue of children or people with disability. It's true, mobility hasn't prioritized them, and yet it's in the UN Decade of Action, they suggest attention to be paid to vulnerable road users, including the children, the elderly, and people with disability. And this is a good area to explore. Then on the aspect of alcohol and road crashes during the day, from one of the interviews, the focus group discussions, one of the participants mentioned that there are crashes that happen as early as 6 a.m. in the morning from people who have been drinking the whole night. And these young children go to school as early as 5 in the morning. They are navigating their way to school. And we have people who are reporting from maybe night drinking activities. So there are some crashes that happen, that have been reported to happen in the morning. And there's need to intervene at that level. Thank you, Karuwango, for that. Then I agree with Richard. Yes, road safety is a shared responsibility. We need to involve all stakeholders. Children are also stakeholders in this, and aspects of supplementing enforcement with sensitization to address the gaps. The key recommendation would be to hold the transport planners and road designers accountable for safety in the system. We should transfer the responsibility from children to the people who design roads, and that is the Safe Systems way of thinking. And I think that is it. Thank you very much.
Thank you, Jimmy, for the responses. Let's take the final round of questions from those in the room. And we plan to be closing shortly. There's a hand next to you, Bonnie.
Yeah, thank you so much, Apostle Jimmy. It's an honor to be here. And I would like to congratulate you, first of all, for the presentation. It was very beautiful. And that is a nice piece of work. I'm calling Fraser's Forum. I work with government. I'm a physical planner. I happen to have a bias on transportation. And I've also done some little research. There's transportation on NMT, walkability, where pedestrian concept falls. I would like, mine is not a question or really a concern, but just a highlight. I think you can see how to come. One, it has already said by Dr. stated about including the aspect of road safety and pedestrian safety in school curricula. I would propose that we would see through your research, sir, if we can find a way of how to make the nation see that it is necessary at every level, as included for education, pedestrian education. And secondly, I'd like to suggest one other thing which I've not read the thesis and say I have, but the aspect of urban design is very, very crucial to making sure there is road safety. First for the road networking and setting. There is what we call street furniture, ITS, intelligent transport system, which can couple up with the technology that somebody stated earlier and make the whole concept very simple. The pedestrians need to augment into this. So I just had those two to highlight. Thank you.
Let's get the hand behind you, then we'll come back here.
Thank you so much, Jimmy. My name is Flavia Nasaka. I'm a journalist. My question is from the recommendation you made that school traffic wardens should be recognized by policies. And I wonder whether you, at baseline, when you are doing this study, whether you assessed their knowledge. I missed it. I don't think you said it. Answer the question. Whether you assess the knowledge of the wardens before at baseline, at the baseline of the study, also because I see some of the private schools recruiting. Did you also assess the recruitment process to see how they assess them before making them wardens?
Thank you, Jimmy, for your presentation and your submission. I've learned a lot from this room today. And mine is not a question, but it's a comment or maybe something you could consider as an advocate for road safety. These learners age between maybe 5 to 13. Those are the ones at the lower level of primary or throughout the primary level. I'd like to think that this would go beyond this auditorium today, more than just giving us the knowledge, but also for you to continue being a strong advocate in this field in terms of liaising with stakeholders in these primary schools to come up with campaigns for these young learners. For instance, I'll give an example. One time we had a campaign to reduce on HIV and AIDS, and there was something called Dance for Life. So maybe you could come up with an intervention like that in schools to launch campaigns that are interesting for these learners in terms of advocating for road safety. They could be in terms of poems, in terms of a dance, something that the learners can remember and retain as they're crossing the road in the morning. They have a picture of what the teacher taught them. Thank you.
There's a hand here at the front.
Thank you, Jimmy. My name is Frederick Oria. I've had people in their questions telling you or asking you and putting the word accident. In your opinion, do accidents exist in your area of expertise? Thank you.
Okay. Is there anyone with a comment or question or final contribution before we give him a chance to respond? Okay, over to you, Jimmy.
Thank you very much for the questions. I will start with Dr. Frederick Oporia. In injury terminologies, we avoid the word accidents because we know what causes these road traffic crashes. We know what works. That's why we don't use the word accidents. That's why you don't hear air crash accidents. So we call them injuries. Thank you, Prophet Kevin, for the question. So that's the team I go with to church. So when I call a prophet, you know that's her calling. Thank you for the question on advocacy. It is important to supplement existing measures with advocacy strategies to make known road safety knowledge. Thank you, Flavia Nasaka, for the question on the recruitment. So, because they work for a short period of time, a traffic warden could either be a teaching staff or a non-teaching staff. So the inclusion criteria should be that they should be an adult who will undergo a training. And the training can be done in the local language or in English, irrespective. So the level of education may not matter. In fact, from the traffic wardens, most of them had, a few had attained secondary level, most had attained primary level, and they were usually the security officers for the school. Thank you, Teacher Fall, for the question of integrating safety in urban designs, which is why I also mentioned that it is a shared responsibility. We need to have physical planners on board to help us plan the non-motorized transport, and also including road safety in school curriculum. Dr. Rose, did I answer that question? I think I did. I think that is it for today. Thank you, and over to you, Chair.
Thank you, Jimmy. Before you call it a day, I have a couple of questions for you at the end of the session, so it's not yet over. First of all, you have been in this journey for a few years. You talked of 4 years and the challenges and many things. What would you say is the one skill you have gained that has been the most beneficial, that's likely going to be even more helpful in your future research career?
That's interesting. The one skill. To me, I would call it resilience, because this PhD journey is really demanding. The project is big in terms of the data collection. You're collecting data from 37 schools. You need to submit journal articles. There is a minimum requirement of 2. You need to have a thesis. You need to juggle everyday responsibilities. Then you need to maneuver the administrative processes of the PhD. So I think I've developed a thick skin for a common good. So the one skill I've gotten is being resilient and managing multiple tasks or activities given to me. Thank you, Chair.
Thank you, Jimmy. The final one, probably the easier one. You've done all this work, we've had all your impact publications, community engagement and beyond. What is your planned next step or your next steps in line with your research post-PhD? What do you envisage doing in the next few years following this good piece of work?
Thank you for raising that. So I actually started on my next steps to see that I advance in injury research together with the team from the Trauma, Injury and Disability Unit. We have been able to get some ongoing activities in other unintentional injuries. There is drowning, there is childhood burns, and I'm utilizing the skill sets that I acquired throughout the training in the PhD. Of course, I have to also give back to community. I want to see how I can be involved in the community dynamics, but also see to it that no one dies on our roads. So I'm going to champion road safety, and I'm going to join the NGO coalition groups to see that we voice over issues of road safety and priority is given to vulnerable road users over vehicles. Thank you very much.
Thank you so much, Jimmy, for that session. I've also learned that you are an apostle, so who knows, you may get another title to apostle by the end of today. But thank you all the audience for being patient and for being on for this long. We have, of course, those here in-house and those online. The next session is for us to have a closed meeting, that is the examiners and the supervisory team. We should take about 10-15 minutes, so please be patient. We need to have some deliberations, and then we'll come back and announce the verdict following this process. So please give us about 15 minutes. For those who can, please stay in-house, and those online, kindly stay on. We should be back in about 15 minutes and have the session closed thereafter. Thank you very much. Okay. So thank you again for your patience. Apologies, it took us a little longer than we thought. We just wanted to make sure that the smoke coming out of the room was white and not black. So I'm glad to now come with the right color of the smoke that has come from the room. So the examination panel has met after the defense, and I wish to inform the audience that the team has found Jimmy Osuret fit for being awarded the Doctor of Philosophy from Makerere University. So congratulations, Jimmy. I wonder whether it's now the time to call you Dr. Osuret, but if not, then it will be sooner than later. The panel felt that you did very well in your presentation, but also responded well to the comments made by them and also the audience. I particularly liked your composure and how you responded to the issues raised, and the team decided and agreed that indeed you did a great job. Following these defenses, the panel is also asked whether there are any other changes needed to be made, even if you have submitted your compliance report. But the panel felt that you've done well and nothing else has to be done moving forward. So the final part of the session is to hear from some key people that have been, of course, part of this particular journey. We'll, of course, hear from the candidate. But before that, let's hear from the supervisory team to get their perspectives and also give them a chance to make a comment on the journey they've been through with you, Jimmy. We'll start with Dr. Victoria, if you don't mind.
Congratulations. Thank you, Chair, and congratulations, Jimmy. Very, very well done. You did say that you're resilient, and that's so true, because when he was ready to start collecting data, the country went into a lockdown. Schools shut. You can imagine that was his audience. And then it was like, what do we do? What do we do in the meantime? So he kept thinking of what to do in the meantime, but the meantime went on and on and on. This country had one of the longest school shutdowns in history. But you didn't give up, you kept going. Also, you're very self-driven. I am sure that good things are going to come from you from this point forth. You'll find that you're going to get even more work than you had in the PhD, so good luck and best wishes. It was a pleasure working with you.
Thank you very much, Dr. Makerere, for those kind words. I believe Jimmy needs them at this point in time. Over to you, Prof. Yomi.
Good afternoon, everyone. And to you, Jimmy, congratulations. I do not have much to say because I remember you as an enthusiastic, upcoming researcher when we met. And when we introduced you to the data set related to Bududa incident, because of that trauma, maybe it could have influenced your belief that you can make a contribution, and the belief has come to pass. So congratulations. Then the other is, I think there was a very tough question by your dad. A very, very hard question by your dad, I think. That, is this the last that you have, are we completed? Do you need to do more? That the answer is yes. So doctoral training is the highest ever that you can have. The rest is luxury. So maybe if you have to take a summer school course in Wisconsin or some other place, go and have summer, go and have a beer, go and have a drink. You are supposed to go and have some bushera or something. But PhD is the highest you can have on earth. So you are there. You want to do postdoc, you can. You don't have to, no problem. Make your money. Have a wedding. Everything that you should do. So congratulations, and I wish you very well. I'm happy that I was part of the board for the engineer. I think I am still. We had those 2 grants for training, and you're able to use it well. So for those who are continuing to study, to work hard, please continue. The journey is still very fresh for you, and we are there to support you. Thank you very much.
Thank you very much, Dr. Atuyambe. We'll now give a chance to the other supervisor who has been part of the team, and that is Professor Ashley Van Niekerk from the University of South Africa, from the Institute for Social and Health Sciences. Over to you, Prof. Ashley. Prof. Ashley, can you hear me?
I can, Chair, I can. Chair, thank you so much. Jimmy, I can't see your face.
Sorry, Prof.
Yes.
Okay, if you can turn on your video, if possible, that would help. I think the audience would love to see the other supervisor, but if you can't, that's fine. But I think, Jimmy, they want to see your face, so please come over to the camera.
Yes, thank you. It needs to be enabled. I can't change it. I can't switch on the camera from this side.
You can carry on. They're going to try and fix it as you go along. Please carry on.
Thank you very much. Jimmy, I was going to say, I'm sure you are smiling from ear to ear. I'm sure your mom and your dad are so pleased and so proud of you. Congratulations. This is fantastic. Jimmy, you work in an important area, as you've conveyed to us. You know that there's almost 250,000 traffic deaths on the continent every year, and the majority of those are children. And despite that, there isn't much research that talks to what works and how we can make things better. And I'm really pleased to be associated with your work, as well as my colleagues, Dr. Lind, Dr. Victoria, Prof. Olive. You know, of course, this is a huge achievement, but your work doesn't end here. The onus on you is now to take this forward and to do something with this. And so you would have heard, you received a lot of really rich comment and discussion about what can be done with children, with families, and so on. And Jimmy, I look forward to seeing you do that. I know that we're celebrating here what's been achieved, and we're talking less about the way forward and all of that. You deserve a good meal, and I hope your parents, your mom and your dad and your family are going to take you for a glorious meal today. You deserve it. Congratulations. Thanks, Jay. Back to you.
Thank you very much, Prof. Ashley, for the kind words. Jimmy has certainly appreciated them. I want to check before we give the chance to the candidate to give his final remarks, if a special person as part of the team, as far as I know, is available to give some remarks, and that is Dr. Olive Kobusinje. I know we didn't prepare you for this, Dr. Olive, but just in case you're able to give a few remarks at this point, we appreciate having known that you were part of this journey from the start, and you've contributed immensely to the process and journey. Dr. Kobusinje, if you are able to, please go ahead now to give any comments at this point.
Good afternoon, everyone, and thank you so very much for the opportunity. I certainly wasn't expecting it, but I'm happy nonetheless. And just to echo what everybody else has said, to congratulate Jimmy on this great achievement. It's been a long journey, but also to I guess, highlight again that Jimmy ventured to work in an area that is not necessarily that popular in this part of the world, and that is fraught with many challenges. And so his work is important in so many ways. And I'm really happy that despite the many challenges that were mentioned by himself, by Victoria, by others, that he persisted and he's been able to bring it to a wonderful conclusion. So Aline said you've reached the pinnacle. You've trained to the maximum that anybody can train. But again, it comes with lots of responsibility. And so as you move forward as Dr. Osuret, you can be sure that we're going to be looking to you to keep pushing the boundaries on this area in scholarship, in excellence, in advocacy, as a researcher, as a scholar, and to be sure that I think it was somebody else, the journalist that said, and maybe a couple others, that it's not just research, it's research to action. It was heartbreaking to hear somebody say that they were an examiner, but they'd lost a son, a wife, and I mean, this is real. This is why we keep working in this field, to ensure that that there's safety on our roads. So Jimmy, congratulations. And thank you so very much, everyone at the school. You've been very supportive. There were so many times that this could have been brought to a different conclusion, when we could have said, listen, Jimmy, schools are closed. If you want to get your PhD, you better choose differently. But there was lots of support from so many different people, and most especially from the supervisors that stayed with him till the end. So thank you very much, everyone, and congratulations once again.
Thank you very much, Dr. Komusinje. I think we needed those words from you. And I wish to inform you that as a department, we are forever grateful to your support, especially with starting the trial unit. And I should tell you that even with you having left that role of heading, we are in good hands, and the current head is certainly taking things to the next level. Thanks again for your mentorship, and I'm sure the team is all in agreement that you've been instrumental in the journey of very many researchers within the trial unit and beyond. Finally, it's now to give a chance to the most recent PhD in the country, I would think, maybe in the world as well, Dr. Jimmy Osuret, to give your final remarks and intervention.
Thank you very much, Chair. Thank you very much, everyone. I want to start by thanking God. Everything we do is to glorify God. And most importantly, the opportunity to be part of this space to make the country safe. I would like to also thank the examiners, Professor Winston. Thank you very much for the questions, overseeing the compliance report. That was good, and the comments you gave me helped me improve the thesis further. And I believe we shall interact more and see how we can work closely. And I could learn a lot if you continue to mentor me. Professor Marie, if she's online, thank you very much for the cross-examination, getting me to think differently about this work that I did, and the comments were really valuable. And Dr. Megan, thank you very much for the cross-examination. I would like to move on to family. I want to thank my dad and mom. Thank you very much for supporting me. First of all, taking me to school, and encouraging me, standing with me, and even being here physically. When you told me you're coming from my defense, the confidence shot to over 100% when I saw you. So thank you very much. And I owe this to you, and I dedicate all this hard work to you, my parents. I would like to go to my church community. We have our lead pastor, Teacher Paul, who's here. Thank you very much. He's so passionate about research in the non-motorized transport, and we shall see how we can advance this. Apostle Mary Susan Abo, thank you very much for coming. Prophet Kevin, Pastor Hope, there is Edith, and we have Martha, we have Benja, we have Peter. I will introduce other people at the right time. So the church community, thank you. Life is spiritual. Any other person who would have gone through the challenges I experienced would have given up, but there was a strong conviction that kept me going. My family, the school family, the School of Public Health, under the leadership of the chair, Professor Esther Brejea. Thank you very much for the opportunity to work with you people. The team is here. There's Professor Sempewa. Thank you very much. Dr. J.B. Isunju. Thank you very much. The chair, Dr. David Musoke. Thank you very much for coming to identify with us. And also people from other departments, Dr. Alosia Senyonjo, thank you very much. There's a grant we got under the leadership of Dr. Senyonjo. We shall be exploring mobility patterns in African cities. And Ezekiel, thank you for coming. Mariana from the department, thank you very much. Then within the department, there's the Trauma, Injury, and Disability Unit. We have Dr. Frederick Oporia, our leader. Thank you very much for coming and always encouraging me. He does a tough critique to prepare you for this. The triad team, Masha, thank you very much. We have Bonnie, we have Wafula, and the entire team that came here and left. Then we have the PhD forum, where we have peers in the journey. They were a source of encouragement. The challenges, the experience are the same. The opportunities are the same. So it's good that we kept that family together and that peer support from the PhD forum, both at the School of Public Health, but the bigger PhD forum at the university. Then also opportunities opened up through the Erasmus program, and Dr. Arthur Bagonza and the alumni were here, but they've gone to rehearse for a graduation that is next week. So it gave me protected time to work on the thesis and finish timely. Then the dean, in her absentia, I want to also thank her for the leadership and the mentorship I have received to date. Then the supervisors. Professor Lynn Atuyambe, thank you very much. You do a very good critique. And that critique helped me to be better and aspire to walk in your shoes. Your leadership, your mentorship has really kept me going in these difficult times. Thank you very much. We first met earlier, I think in 2014-15, where you mentored me in qualitative research, and we have a publication as a result of that. Thank you very much. We also have Professor Ashley Baniaka from South Africa. I was with him for a month at Cape Town, and he was very instrumental in mentorship, but also in the conceptualization and critiquing the manuscripts that were accepted. Thank you very much, Professor Ashley. I look forward to coming to visit you, and we advance work in burns injury. There's a grant we got in burns, and we are referencing part of the work that you're doing. Thank you very much. Then Dr. Nankamira, who has just stepped out, was also very instrumental in the design of the trial and the quantitative studies. I also thank her for the mentorship and guidance. So I would like to give thanks in a song, and I'm going to invite two people here. There's Prophet Martha and Peace to come to the front. And use this. So I also have some good news to share, because I'll never get this opportunity. So Apostle Peace over here is my wife to be, and we are getting married on the 14th of February. So continue to pray for us, and thank you. So they're going to join me in ministering in a song. Okay?
If you may, where you are, you may stand up on your feet as we give thanks unto the Lord for all he has done. This specific occasion from Apostle Jimmy, who is now Dr. Jimmy Sanonasa. You've done so much for me, I can't now tell it all. If I had 10,000 times, it still won't be enough. When you heal completely. What shall I render to you, Jesus? For you so very much for me. What shall I render to you, Jesus? For you so very much for me. You, Jesus, for you have done so very much for me. What shall I bring to you, Jesus? For you have done so very much.
Thank you very much. And Over to you, Chair. Let me sign out.
Yes, you can sign out and start wedding preparations for sure. With that, colleagues, thank you once again for staying for this long. It's been a long day, but I'm glad it went well. Apologies again for the small glitches, but I'm glad we've gone through it. We are now going to have a good photograph. So all those who are within here, let's have a photograph before. Okay, so we're going to have a group photograph with all of us who are in the room, and then the camera person will see which other photographs he wants to take with any smaller groups, and then we'll go downstairs for a cake that has been prepared for us all. Of course, for those who are in person, those online, I'm not sure what arrangement has been made, but at least those who are in person will have some cake. I always ask myself, what would happen if the kind doesn't pass and they prepare the cake? Would it be eaten still or it would be taken back? But anyway, Dr. Osuret has passed and we can enjoy cake. Thank you once again and have a good rest of the day.